All right, good morning, everybody. Dr. Rayfish here from Vet Triage. It is Thursday, October 24th, 9:31 a.m. Pacific time. We're going through this issue of JAVMA from January 15, 2016. We're going to talk about risk factors for the development of aspiration pneumonia for unilateral arytenoid lateralization in dogs with laryngeal paralysis, 232 cases from 1987 to 2012. The objective is to identify risk factors for the development of pneumonia after unilateral arytenoid lateralization in dogs with laryngeal paralysis. For those who want more information on laryngeal paralysis, I have a video on this channel, both describing it for pet owners, but also describing it during a seminar for veterinarians and veterinary technicians as well. The results of this study found that at the 1 year, 3 year, and 4 year follow-up periods, aspiration pneumonia occurred in 18.6%, 31.8%, and 31.8% of dogs, respectively. The 1 and 3 year and 4 year survival of dogs with postoperative aspiration pneumonia was 83.1%, 51.5%, and 25.8%, respectively. None of the dogs with aspiration pneumonia before surgery had clinical signs of aspiration pneumonia after surgery. Postoperative megaesophagus had a risk factor of 2.58 with regard to developing pneumonia, and dogs with postoperative administration of opioid analgesics prior to being discharged from the hospital had a risk factor of 1.69 for development of pneumonia. Metoclopramide did not change the risk of aspiration pneumonia. So a few things to go over there just for folks to understand. Number one, aspiration pneumonia means that the dog inhaled gastrointestinal contents into their lungs and then developed pneumonia. Right away, I have a problem with this study in that they don't discuss that there could be other forms of pneumonia. Dogs can develop pneumonia, or more accurately, bronchopneumonia, for a variety of reasons, not just aspiration. So they're assuming aspiration here throughout the study when it may not be. Secondly, unilateral arytenoid lateralization is also called a tie-back surgery. It's where the surgeon will go in on the side of the dog's neck, usually left side, because most surgeons are right-handed, and they'll open up the airway more using a permanent prosthetic that's placed in the neck. Laryngeal paralysis, those who don't know, is when the vocal cords become weak over time, usually over months or even years, to the point where it goes from paresis, which is weakened vocal cords, to paralysis, which the vocal cords can't move. And then that's when the dogs start having a suffocation emergency, an upper airway obstruction. Let's go into the discussion here, or in the introduction. Laryngeal paralysis causes upper airway obstruction in large breed dogs, and idiopathic polyneuropathy has been identified as the most common cause of laryngeal paralysis. Idiopathic means we don't know what causes it. Polyneuropathy means that multiple nerves in the body are affected with some sort of degenerative process. Unilateral arytenoid lateralization is the most common surgery. Complications of this surgery include recurrent upper airway obstruction because of surgical failure, so like suture failure or seroma formation, and vocalization changes, which is called dysphonia. Postoperative aspiration pneumonia may affect 5 to 24% of dogs after surgery. In this study, dogs were diagnosed with laryngoscopy. They also did take into account thyroid profile results. So they measured thyroid stimulating hormone as well as thyroxine concentration, because there has been association with hypothyroidism in dogs and developing aspiration pneumonia. The presence of progressive neurologic disease following surgery was determined on the basis of veterinarian neurologic examination or owner impression of hind limb weakness or generalized weakness in the absence of other known neurologic causes. And when they couldn't distinguish between orthopedic and neurologic disease, they just assumed that they had neurologic disease. All right. Radiographic evidence of aspiration pneumonia was specifically based on focal alveolar pattern with dependent lung lobes. Diffuse interstitial disease, diffuse alveolar disease, atelectasis, focal soft tissue opacities, or a combination was not considered for aspiration pneumonia. So aspiration pneumonia can look like a bunch of things. It doesn't always have that characteristic description that they have here with focal alveolar pattern in the dependent lung lobes. It's not always the case. And so that's a weakness right there, where they may be missing dogs that have pneumonia. In cases where radiographic evidence was not definitive because of mild radiographic changes or difficulty in interpreting the x-rays or both, dogs were recorded as having preoperative aspiration pneumonia if multiple clinical signs of disease, including cough, fever, lethargy, and exercise intolerance, were also found. Complications were classified as short-term, which is within 14 days after surgery. Long-term is after 14 days. Acute death was defined as intraoperative death or death occurring within 24 hours. A death related to arytenoid lateralization was defined as any death or euthanasia secondary to aspiration pneumonia, failure of repair, upper airway obstruction, or other undetermined cause of death. Mortality was classified as short-term within 14 days and long-term, which is after 14 days. Okay, the results of the study. 232 dogs underwent unilateral lateralization procedures, and it was left-sided. So, of course, right off the bat, we wondered if they had on the right side, does that change anything? And, of course, you always like to have more dogs, although 232 dogs is a pretty good number. 46% were labs, 11% golden retrievers. Most were large breed dogs, 76 pounds on average, and they were older, 10.6 years. 65.5% were males. The dogs that did not receive a pure opioid after surgery received a local anesthesia like bupivacaine until they were able to get tramadol orally. Low thyroid levels was diagnosed in 47.5%. Generalized polyneuropathy was seen in 28%. Preoperative megaesophagus, 2.9%. Postoperative megaesophagus, 3.8%. Preoperative pneumonia, 9.2%. Megaesophagus can be both focal or local megaesophagus, meaning it just affects the esophagus, or it could be generalized megaesophagus, meaning part of a more severe neurologic disease like polyneuropathy. Postoperative complications were seen in 29.4% of dogs. 2% of dogs died in the postoperative period because of aspiration pneumonia. Acute complications, meaning within the first 14 days, occurred in 18.1% of cases. Incision problems occurred in 7.6% of dogs. Aspiration pneumonia developed less than 14 days after surgery in 11.6% of dogs. Failure of surgery, 5.9% at a median of 48.5 days after surgery. Persistent stridor was reported in 13% of dogs. Aspiration pneumonia developed after 14 days in 6.8% of dogs. The 1-year survival rate was 93.6%, 2-year survival 89.1%, 3-year 84.4%, and 4-year 75%. 7 years after surgery, survival was still 75%. 9.2% of dogs died or were euthanized for reasons related to respiratory disease. 3.8% of dogs died or were euthanized for related causes during the short-term period, and 5.8% of dogs died or were euthanized of related causes during the long term. 6.7% of dogs were euthanized for clinical signs of aspiration pneumonia. 2.5% of dogs for acute respiratory disease of unknown cause. 39.4% of dogs died for unrelated causes. 28.4% euthanized based on progressive neurologic disease in the absence of other known comorbidities. The 1-year rate of aspiration pneumonia, 18.6%, 2-year rate, 27.2%, 3-year rate, 31.8%, and 4-year rate was also 31.8%. The 50% survival for dogs with postoperative pneumonia was 3.2 years. And the 4-year survival of dogs with postoperative pneumonia was the 1-year survival rate for dogs with pneumonia was 83.1%. The 2-year survival, 63%. 3-year survival, 51%. 4-year survival, 25.8% of the dogs that developed pneumonia after surgery. Risk factors for development of pneumonia in the short term, meaning less than 14 days, included postoperative administration of opioids, that's a risk factor of 1.69, and the diagnosis of postoperative megaesophagus, risk factor of 2.58. For the long-term development of pneumonia, the diagnosis of postoperative megaesophagus was the risk factor, and that's a risk of 3.89. 3 of the 7 dogs with preoperative megaesophagus also had megaesophagus after surgery, so less than 50%. The presence of preoperative megaesophagus was not associated with an increased risk of pneumonia. The presence of neurologic signs during the clinical evaluation before surgery was also not associated with the risk of pneumonia or the risk of developing postoperative megaesophagus. So discussion. In the present study, aspiration pneumonia was the most common complication. The incidence of aspiration pneumonia at 1 year is 18.6%, 2 year 27%, 3 year 31.8% after surgery. 75% of dogs are still alive 7 years after surgery. Large breed dogs are typically affected with laryngeal paralysis. They're usually 10 years old. They're usually labs and Goldens, which is consistent with this study. Aspiration pneumonia was diagnosed after surgery in 9% of cases. Idiopathic polyneuropathy were present in 9%. Low thyroid was diagnosed in 47.5%. The 75% survival rate at 7 years was excellent. Another study showed a 70% survival at 4 years for dogs treated with surgery. Another study showed that the median survival time was 12 months, but that was only 39 dogs. Another study showed that severe deterioration of neurologic status within a year of diagnosis of laryngeal paralysis, but they didn't report survival times in that study. Polyneuropathy was seen in 28% of dogs in this study. Low thyroid can cause polyneuropathy, and they do mention here that the thyroid supplementation has not been evaluated with respect to its influence on treatment of laryngeal paralysis. I thought it was already shown that treating dogs with hypothyroidism does not reverse laryngeal paralysis. It may be that this study is old, it's from 2016, but that may be an issue there. 19% of dogs experience signs of pneumonia in the postoperative period, with 68% of affected dogs being free of aspiration pneumonia 3 years after surgery. Aspiration pneumonia was a negative risk factor for short-term and long-term survival in dogs, with 25% of dogs alive at 4 years after surgery. Aspiration pneumonia has been reported to affect 5 to 24% of dogs. With unilateral lateralization, pneumonia has also been reported in 30% of cats with laryngeal paralysis treated with the same surgery. Another study showed that 23.6% overall rate of pneumonia when the results of unilateral or bilateral lateralization and arytenoidectomy were evaluated. So those are multiple surgeries, which does increase the risk of developing pneumonia. Another study reported a rate of 6% in a study that had a combination of bilateral lateralization and ventricular chordectomy performed through a ventral approach. All right. So this reduction in opioid administration likely permitted these dogs to regain sternal recumbency and not be on their side for a long period of time, which may predispose them to aspiration pneumonia. Morphine also has been shown to influence gastrointestinal motility and the tone of the lower esophageal sphincter, which makes them risk for reflux and then pneumonia. Metoclopramide administration may increase the lower esophageal sphincter tone, which could reduce reflux, and maybe we should consider cisapride because it has stronger effects on the lower esophageal sphincter. So if the lower esophageal sphincter is tightened, it means that reflux has less likely chance of going up the esophagus and into their lungs. Esophageal dysfunction in 62% of dogs manifests as reflux, as documented in previous studies by fluoroscopy, and it does increase the risk of aspiration pneumonia. Another study showed that postoperative megaesophagus has a risk factor for development of complications by a risk factor of 4.8, and it affects survival, risk factor 7.4 in dogs with laryngeal paralysis. A potential explanation for the radiographic evidence of preoperative esophageal dilation, so megaesophagus, might be the presence of aerophagia secondary to dyspnea, reflex esophagitis, or positional changes. If true esophageal dysfunction is present before surgery, then a permanent tracheostomy has been recommended. I think it's a bit extreme, and we probably need more studies to show that's actually the case. The mechanism of aspiration before and after surgery may be different. Upper airway obstruction has been found to increase the risk of reflux. Esophagitis and reflux are associated with a decrease in has been reduced if you fix the upper airway obstruction. In another study, they reported that 62% of dogs with upper airway obstruction due to laryngeal paralysis have reflux. Reflux has been associated with pneumonia in human patients. Therefore, it's entirely possible that dogs with laryngeal paralysis develop pneumonia before surgery because of reflux, but then Postoperatively, the risk of aspiration may be the result of the actual surgery, which enlarges the laryngeal opening and prevents the dogs from adequately protecting themselves from aspirating. Esophageal disease has been reported in other studies to be the most important cause of aspiration pneumonia in dogs. And that's the study. So there's a few weaknesses for the paper, but overall pretty good. Yeah, hopefully that helps you folks out, especially if you're dealing with laryngeal paralysis in your dogs. We'll see you guys again tomorrow. Take care.